Okay, this is a human heart. Its the size is same to the fist of the person. And first, let's observe the external feature of the heart, and then the internal feature. It's like the position is like this position, like this, and the heart lies in the middle mediastinum, and 2/3 on the left, 1/3 on the right. It's a sternocostal surface, like this. Sternocostal surface, sternum and costal cartilage. So sternocostal surface is comprised of the left ventricle and right ventricle. This is a cardiac base. The cardiac base is formed by the left atrium and the right atrium. This is a diaphragmatic surface. Like this. It's upon the diaphragmatic surface. And this is some blood vessels. Superior border. This is a right border, left border, and inferior border. And this is aortic, ascending aortic arch, and this is a pulmonary trunk, and this is a superior vena cava, inferior vena cava. There are some grooves on the external surface of the heart. For example, this is a anterior interventricular groove. This is a coronary groove. The coronary groove is the division line between the atrium and the ventricle. This is a posterior interventricular groove. And anterior interventricular groove will anastomosis here. It's termed incision. And there are some vessels, for example, the arteries and the veins in the groove, the coronary groove. There are 4 chambers in the heart. The first one is the right atrium. It's the right atrium. Right atrium, there are 3 orifices, 3 inlets. This is a superior vena cava, inferior vena cava. And here you can observe orifice. It's orifice of coronary sinus. The coronary sinus is here. Here is the coronary sinus. It's located on the coronary groove, and opened into the right atrium. So there are 3 inlets: orifice of superior vena cava, inferior vena cava, and coronary. The coronary. The coronary sinus. And one outlet is the orifice of right atrioventricular. Here, it will open into the right ventricle. This part is termed the right auricle. The right atrium can be divided into 2 parts. This part is the wall of this part is very smooth. And here there are some pectinate muscle right from the crest, terminal crest crest. On the interatrial septum, there are a very thin part here. You can touch it. It's termed the fossa ovalis here. It's easily to be opened. It's a defection. If it's not closed after birth, it can be the defection.
This one.
Well, fossa ovalis. Yeah, fossa ovalis.
Patient doctor started something.
这是卵圆膜，fossa ovalis.
Okay.
In the fetal, it's opened. After birth, it will closed.
Okay.
And this is some structure of the right atrium. Now let's look at the right ventricle. The right ventricle here. Yes. Right ventricle. And there is one inlet, one outlet. This is the inlet from the right atrium into the right ventricle. And this is the outlet open into the pulmonary trunk. There are two kinds of wall. This is a tricuspid wall. This is a pulmonary wall. The wall is function to permit the blood flow in one direction. And this is a papillary muscle, and it will connect with tendinous cords with the cusp of the tricuspid wall. And these can be regarded as complex. This structure is termed the supraventricular crest. Supraventricular crest. Its division line of the inflow tract between the inflow tract and the outflow tract. The tricuspid wall. You can observe it. This is let's look at the left atrium. This is the left atrium. It's located in the cardiac base. And there are four inlets. Two in every side. Two on every side. It's termed the pulmonary vein. There are four pulmonary veins in it, and only one outlet. Here, one outlet here. It's connect with the mitral valve. There are also the papillary muscle, the tendinous cords, and the wall. And the outlet will open into the aortic wall. This aortic wall. You can observe the wall, the thickness of the left ventricle is most thickest. You can compare the thickness of the wall of the left ventricle with the right ventricle. It's thinner than the left. And this is a interventricular septum. there are some. This is a left auricle. Left auricle. Left auricle. It's a right auricle. This is some important structures of the heart. The heart. Sternocostal surface. Sternocostal surface. The diaphragmatic surface. The cardiac base. This is cardiac apex. Cardiac apex. And the anterior interventricular groove. The coronary groove. Coronary groove. Posterior interventricular groove. And this is a crux. Atrioventricular crux. This is the coronary sinus. Coronary sinus. Coronary sinus. In the right atrium, this is a auricle. This is the right auricle. Superior vena cava, inferior vena cava, and the orifice of the coronary sinus. Coronary sinus here. And 3 inlets, 1 outlet. Okay. And the fossa ovalis. The pectinate muscle. The right ventricle, the tricuspid wall. The tricuspid wall composed of 4 structures: the annulus, ring annulus, and the walls. There are 3 kinds of walls: anterior, posterior, and septal walls. The tendinous cord and the papillary muscle. This is the supraventricular crest. It's a division line between the inflow tract and the outflow tract. The outflow tract will open into the pulmonary trunk. The pulmonary trunk, there is also the walls. It's termed it's seminular. Seminular. 3 walls form the pulmonary wall. The left atrium. There are 4 inlets. The right superior pulmonary veins, right inferior pulmonary veins, left superior and left inferior pulmonary veins open into the left atrium. It will open into the left ventricle. And on the orifice of the left atrioventricular, it's enclosed with a mitral valve. The outlet is a aortic valve. Here, and to form the ascending aorta, the aorta arch. Okay.